Sathyabama Institute of Science and Technology.
I am Prathiba, Assistant Professor, Department of Mental Health Nursing, Sathyabama Institute of Science and Technology. Today, I am going to talk about the topic on Introduction to Mental Health Nursing. So, before starting, I would like to give small introduction about the topic which I am going to speak on. Health. Thinking of health. First thing that comes to our mind is physical health. We don't much bother about the mental health. We have to focus both mental health as well as physical health. There is a link between body and mind. There is a relationship between the body and mind. If the body is affected, our mind gets affected. Similarly, if the mind is affected, our body gets affected. Therefore, we have to focus both mental as well as physical health. So with this, I'll begin my today's topic, mental health nursing. It is a dynamic interaction between the nurse and the patient. It involves the use of knowledge and skills to assess the patient's behavior, personality, mind, mental disorders, and most importantly, building interpersonal relationship between the nurse and the patient. So mental health nurse, so first she has to assess the patient's mind and personality and behavior problems and all she has to assess and also she has to establish therapeutic nurse-patient relationship as well and also build interpersonal relationship between the nurse and the patients. Next, I move on to the definitions. Definitions, according to World Health Organization, health is a state of physical, mental, and social well-being, not merely the absence of disease. According to Carl Menninger, mental health is an adjustment of human beings to the world and to each other with a maximum of effectiveness and happiness. It is how we fit into the world and manage our life with success and happiness. Next, psychiatry. It is a branch of medicine that deals with diagnosis, treatment, and prevention of behavioral, mood, and emotional disorders. Next, I move on to the components of mental health nursing. The first component is ability to accept self. First, we have to accept ourselves. A mentally healthy individual feels comfortable about himself. Second one, the capacity to feel right towards others. Here, a mentally healthy individual who enjoys, a mentally healthy individual will show interest on others' welfare. The third component is the ability to fulfill life's tasks. A mentally healthy person is able to think for himself, set reasonable goals, and make his own decisions. The next, I move on to the indicators. Indicators of mental health nursing. The first indicator is a positive attitude towards self. A mentally healthy individual should have a knowledge and acceptance of strength and limitation. First, he has to accept the strength and he has to find out the limitations. Next, a mentally healthy individual should have a strong sense of personal identity and feel of security within the environment. The second indicator is growth, development, and the ability for self-actualization. This indicator correlates with achievement of tasks associated with each level of development of the individual. A mentally healthy individual should accomplish the task at each stage of life, from childhood to adulthood period. If they fail to accomplish the task, there might be some health related issues. Like for example, if a child, there might be having some problem like learning disabilities. So we have to, that means a mentally healthy individual should accomplish the task. So that means the child fails to complete the expected task. Then third indicator is integration. Integration includes the ability to adaptively respond to the environment and the development in regard with the philosophy of life, both of which help individual maintain anxiety at a manageable level in response to a stressful situation. So mentally healthy individual has to manage his anxiety level any stressful situations. Autonomy. It refers to individual's ability to perform in an independent, self-directed manner. So he has to work independently without depending on others. The individual makes choices and accepts responsibility for the outcomes. The next indicator is perception of reality. Here, a mentally healthy individual should perceive the environment without any distortion, as well as the capacity for empathy and social sensitivity respect and concern for the wants and needs of others. The last one, environmental mastery. This indicator suggests that the individual has achieved a satisfactory role within the group, society, or environment, so he is able to love and accept the love of others. The next one, I move on to the characteristics of the mentally healthy individual. So a mentally healthy individual has the ability to adjust in the environment, and he has a sense of personal worth, feels worthwhile and important. He has a sense of responsibility. He can give and accept love. He lives in a world of reality rather than the fantasy, and he solves his own problem by his own effort, makes his own decisions. So these are the characteristics of mentally healthy individual. Next, I move on to the definition of mental illness. Mental and behavioral disorders are understood as clinically significant conditions characterized by alteration in thinking, mood, or behavior associated with personal distress or impaired functioning. So there will be changes in mood, behavior, and personality which affects the person's life, which cause distress to the individual. The next, characteristics of the mental illness, changes in one's thinking. There will be changes in thinking, memory, and perceptions, feeling, judgment, which result in changes in behavior causing distress to the individual or to others as well. Next topic is features of mental illness. These are the features. The first feature is disturbances in bodily functions. There will be disturbed sleep, increased and decreased food intake, disturbances in bladder and bowel functions. The second feature is disturbances in mental functions. There will be altered attentions, lack of attention, concentration, and impaired judgment, and disturbed perceptions and disturbed memory. Then third feature is changes in individual and their social activities. They are not able to focus on one goal, so they will try to neglect their self-care, and strange behavior with family members, friends, colleagues, and others. The last one is the somatic complaints. The mentally ill person, they have the following complaints: aches and pains in different parts of body, fatigue, weakness, involuntary movements. So these are the features of mental illness. So next, I move on to the evolution of mental health services. So before entering to the evolution of mental health services, just I would explain about the mental health services. In olden days, the mentally ill person were identified as a demon, and they were possessed by evil spirit. So they were burnt and beaten to death. Now the mental health services has brought drastic changes into this. So the Pythagoras, he developed the concept that the brain is the seat of intellectual activity. Hippocrates, he described the mental illness as hysteria, mania, and depression. Plato, he identified there is a relationship between the body and mind, and Asclepius, who is referred to the father of psychiatry, he introduced the simple hygienic measures, diet, and the massage in place of mechanical restraints. Mechanical restraints is nothing, just mechanical restraints is the example of some mechanical restraints or straps, and these are the materials were used to tie mentally ill person in olden days. So like Asclepius, he is the psychiatrist, he introduced some simple kind of measures instead of mechanical restraints. Next, I move on to the important milestones in mental health services. In 1773, the first mental hospital in the US was built in Williamsburg, Virginia. In 1812, the first American textbook, Psychiatry, was written by Benjamin Rush, who is referred to as the father of American psychiatry. In 1912, Eugen Bleuler, a Swiss psychiatrist, coined the term schizophrenia, that is split mind. And in 1949, lithium was first used for the treatment for mania. In 2013, the Mental Health Care Bill was introduced in the Rajya Sabha in 2013. Next, I will explain about the development of modern psychiatric nursing. In 1882, the first school to prepare the nurses to care for mentally ill at McLean Hospital in Waverly. In 1913, Johns Hopkins became the first school of nursing to include a fully developed course for psychiatric nursing in the curriculum. In 1965, the Indian Nursing Council included psychiatric nursing as a compulsory course in the BSc nursing program. In 1991, ISPN, Indian Society of Psychiatric Nurses, formed at NIMHANS, National Institute of Mental Health and Neurosciences at Bangalore. Next, I'll explain about the mental health team. Mental health team, there are mental health team members are group of members, group of professionals from different disciplines who work together to provide services to mentally ill patients. These team members include psychiatric nurse, clinical psychologist, psychiatric social worker, counselor, pharmacist and dietitian, and occupational therapist. I'll explain one by one. The first one, the psychiatrist. He is a medical doctor who has specialized in psychiatry. He is accountable for the medical diagnosis and treatment of mentally ill patients. The second one, psychiatric nurse. Psychiatric nurse is a registered nurse with a specialized training in the care and treatment of mentally ill person. The clinical psychologist should have a master degree in psychology or PhD in clinical psychology with specialized training in mental health settings. Then psychiatric social worker, he should have a master degree in social worker, PhD degree with specialized training in mental health settings. Then occupational therapist, here the mentally ill patient will be given recreational or occupational activity to divert the mind and also to improve their skills so that they can lead their life independently. The occupational therapist or an activity therapist is accountable for recreational, occupational and activity programs. He assists the patients in gathering skills that help them cope more effectively, retain employment and use their leisure time. Counselor provides basic supportive counseling and assist in psychotherapy and recreational activities. With this, I conclude my topic. Health is very important, not only physical health but also mental health. A mentally healthy individual has to adjust and respond to the situations, and he would be able to cope with stressful situations. In psychiatric nursing, it's a very important part of healthcare that focuses on helping people with mental health issues, any mental health problems. It's not just about giving medicines, but also understanding the patients, identifying the patient needs and supporting the patients emotionally. As a future nurse, it's very important have to develop patience, empathy and professional skills to provide holistic care to patients with mental health needs. That's all. Thank you.